The topic of this case study project is latex glove allergy. The PowerPoint presentation was curated by Doreen Khalifa, and the video that was inserted within this PowerPoint presentation was assisted by my classmates An and Annabella. Here is the case study. The dental hygienist is running late and does not review the patient's chart thoroughly prior to beginning the cleaning. They don a pair of gloves and begin to clean the patient's teeth. Within minutes, the patient experiences a severe allergic reaction. Here is a video demonstration of a severe allergic reaction from latex gloves allergy in the dental office. The dental hygienist enters the room abruptly and apologizes to her patient An for her tardiness. She explains that she is running behind schedule. She briefly reviews the medical history in the patient's chart, missing the fact that there is a medical alert regarding a latex allergy. She does not ask any additional questions and even forgets to take her vitals since she is rushing to start the cleaning. She informs her patient that she is going to don her PPE, more specifically, her latex gloves. She comes back in the room and informs her patient that they are now going to begin the cleaning. She places her patient in a supine position and proceeds with the cleaning. Within minutes, the patient begins to experience troubled and labored breathing. The dental hygienist notices that the patient begins itching all over and redness and hives begin forming rather quickly. The dental hygienist asks her patient if she has any allergies. The patient confirms that she has an allergy from latex. The dental hygienist immediately removes the latex gloves. She informs Anna, the dental assistant, that her patient is experiencing a severe allergic reaction to the latex gloves. She tells her to call EMS to bring an oxygen tank and the EpiPen from the medical emergency kit. She now begins to evaluate her patient's level of consciousness and vital signs, noting severe hypotension and tachycardia. She kept the patient in a supine position, making sure her legs stayed elevated. She checked her patient's circulation, airway, and breathing. She notices the patient exhibiting laryngeal edema. She notes the time and administers 0.3 milliliters of epinephrine in the upper thigh muscle, making sure to keep it there for 10 seconds for adequate administration. She then administers 4 to 6 liters per minute of oxygen. She continues to monitor vital signs, noting the time. She maintains patient comfort and informs her patient that she will stay with her until EMS arrives. This is very important in case a biphasic reaction occurs. What is an allergic reaction? An allergic reaction is a hypersensitive reaction to an ordinarily harmless substance. The most common allergens include dust, pollen, latex, foods such as peanuts, tree nuts, shellfish, milk, eggs, and wheat, insect stings, and medications, particularly NSAIDs, aspirin, penicillin, and radiographic contrast media. Some common allergens that you can find in a dental office include latex gloves, glutens, pine nuts in some fluoride varnishes, the sodium bisulfite preservative in local anesthetic agents with vasoconstrictors, and ester-type topical anesthetics. There are 4 types of allergic reaction. Type 1 reaction is an immediate hypersensitivity caused by immunoglobulin E. It is referred to as a common allergy. Type 2 reaction is cytolytic in nature and causes cell death. Type 3 reaction is not immunoglobulin E mediated, yet still exhibits anaphylaxis-type symptoms. It is referred to as anaphylactoid reactions. And lastly, type 4 reaction is a delayed allergic response that takes more than 12 hours to develop. This often manifests as contact dermatitis, along with other common symptoms of an allergic reaction. There are 3 stages of an allergic reaction. The first one is a mild allergic reaction. This could progress to a moderate allergic reaction, and lastly, severe allergic reaction, which is also referred to as anaphylaxis. The first type of allergic reaction is a mild allergic reaction. Some signs and symptoms that can occur with this type is localized redness, localized itching and hives of the skin, some edema, conjunctivitis, pale or flushed skin, and rhinitis. The treatment for this type of allergic reaction is to first remove the causative agent. This is actually going to be the first step in every type of allergic reaction. You always want to remove what's causing the allergy. Next, you want to, of course, monitor vitals, and oral histamine blocker administration is highly recommended. Oral chlorpheniramine is a type of histamine blocker which can be given at 4 milligrams every 4 to 6 hours, and oral diphenhydramine, also known as Benadryl, 25 to 50 milligrams every 6 to 8 hours for 3 days. You definitely also want to make sure to refer to a healthcare professional. The second type is a moderate allergic reaction. Some signs and symptoms that can present with this type is systemic redness, itching and hives, edema, rhinitis, bronchospasm or dyspnea, abdominal pain, cramping, and diarrhea. The treatment for this type of allergic reaction is to, again, remove the causative agent. You want to monitor vitals, you want to administer an injection of a histamine blocker along with an oral histamine blocker. This could be diphenhydramine, which is Benadryl, 50 milligrams intramuscularly. You want to also administer oxygen at 4 to 6 liters per minute because your patient would be exhibiting troubled breathing. And of course, you want to refer to a healthcare professional. The third type is a severe allergic reaction. This is also known as anaphylaxis. Some signs and symptoms can include systemic redness, itching and hives, dyspnea, severe hypotension, and angioedema of the eyes, lips, or larynx. The treatment for this type of allergic reaction would be to remove the causative agent. You want to immediately call EMS, monitor vitals, and administer an injection of epinephrine, 0.2 to 0.5 milliliters of 1 to 100,000 solution. Now, typically in a dental office, the medical emergency kit will have an EpiPen. The EpiPen is an auto-injector and it delivers 0.3 milliliters. You want to make note that a maximum of 3 doses in total can be administered of the EpiPen. A steroid is also recommended. That could be hydrocortisone, 100 to 500 milligrams intramuscularly, and a histamine blocker, diphenhydramine, 10 to 20 milligrams intramuscularly. You want to also administer oxygen at 4 to 6 liters per minute. I want to make note here that typically what you'll do as the dental hygienist with a patient experiencing a severe allergic reaction is you would administer the epinephrine or the EpiPen. Typically, the intramuscular injections of the steroid or the histamine blocker would be given by the emergency department because it's typically not recommended to do that in a dental office. Here are some ways to prevent an allergic reaction from occurring. You want to, of course, avoid exposure to specific allergens to prevent an allergic reaction. This is known as the best method of prevention. If you know that you are prone to allergic reactions, you want to make sure to carry an EpiPen at all times. As the clinician, it is our responsibility to always thoroughly review our patient's medical history for allergies. If it's not written, it doesn't hurt to ask again to double check. It's better to be safe than sorry. You want to be familiar with allergy testing. That could be the skin prick, the skin scratch, or the radioallergoabsorbent test, known as RAST. The skin prick is when an allergist or immunologist injects the suspected allergen under the skin on the patient's arm or back. If the patient is allergic, a small raised red area will result within 15 minutes of the injection. I made sure to insert a picture of this type of test here on the bottom right. You could see that there's multiple spots, there's white spots all over the back. These are different allergens that are injected underneath the skin, and of course, if the patient is allergic, there are multiple red areas that can appear on the patient's skin. The skin scratch is the second type of allergy testing. It's very similar to the skin prick test, but instead of injecting the allergen, it is placed on the patient's skin, and then the skin is scratched. RAST is a laboratory test performed on the blood to test for the amount of specific immunoglobulin E antibodies in the blood, which are present if there is a true allergic reaction. This is known to be the most reliable test. We've reached the end of the presentation. Thank you for watching, and I hope you enjoyed.